And press off.
Is it recording?
Huh?
According to the National MS Society's website, 2.3 million people worldwide have been diagnosed with MS. I did an audience analysis, and I asked them 3 questions. If they were familiar with MS, if they knew anyone or themselves had MS or had been diagnosed, and also if they see MS, people with multiple sclerosis confined to a wheelchair. Most people are familiar with MS, but the thing that surprised me is most people picture people with multiple sclerosis confined to a wheelchair. And that's not always true. People have, with MS, have physical disability, and they have what I call invisible disability. So I'm going to go through and talk about what MS is, the diagnosis, how it's diagnosed, the symptoms, the treatments, the types, things like that. So MS, or multiple sclerosis, is just that. Multiple is many, sclerosis is scars, because what happens is your immune system attacks itself and leaves scars. So you have in your brain and spinal cord, this would be myelin that covers your nerves. And when your immune system thinks that it has an infection or anything like that, it attacks your myelin and it eats away this black part right here, exposing your nerves, which would be these wires. And that slows down the nerve signals to the rest of your body, causing you to act all wonky. Everyone has different symptoms, and sometimes the symptoms are more severe or less severe with each type. People with progressive MS tend to have more physical disability because it affects more of their spinal cord. But you can have leg weakness and arm weakness, tingling and numbness sensations, which cause you to drop things or fall. You can have muscle spasms. Your vision can blur, so it's like looking through wax paper. It also affects your memory, and it's hard to keep things in. It can also affect your speech. People will sound like they have slurred their speech, or it's hard for them to get the words out. It also affects your attention, so it's kind of hard to focus. And diagnosing MS is kind of difficult because it mimics so many other conditions. It's kind of like if you Google, symptoms for a cold, it could come back symptoms for cancer, that kind of thing. The most popular conditions it mimics is lupus and Lyme's disease. So they do a blood test first to rule out anything else, and then they will give you an MRI of your brain and your spine. They check your cervical spinal cord, and then your thoracic, which is the middle of your back. People with more severe symptoms have a lumbar puncture or a spinal tap, and that's where they stick a big needle through your lower back and they pull out fluid. And in that fluid, they're looking for antibodies or bands that MS leaves. And some people will have a nerve test, and they stick electrodes in your muscles to test how the nerves are responding to the signal. There are a few types of MS. The most popular is relapse-remitting MS. 85% of people generally are diagnosed with relapsing type. When that worsens, you get the secondary progressive MS, and that just means that you don't have any flare-ups or symptom-free time. The lines get blurred in between. The more advanced is the progressive, primary progressive. Only 10% of people get initially diagnosed with that. And then when you're having to where you don't have any symptom-free time, all you feel is whatever symptoms you start with, that is known as progressive relapsing, and that's very rare. Only 5% worldwide get diagnosed with that. There are a few treatments. People can go a more natural homeopathic way. They can do acupuncture, try the CBD oil, yoga, diet changes. You can also do a disease-modifying therapy, otherwise known as a DMT, and that includes a self-injectable drug. Doctors do not really recommend that anymore because people do not like to inject themselves, and they tend to run out of injection sites. Those injectables can be in the muscle or underneath the skin. So they also have a pill form or an oral medication. If that does not work for you, if you're not good at remembering to take pills every day, because you do have to take it every day, then you can do the infusion. There are two types of infusions. One is Tisabri and the other is Ocrevus. The one I will do will be Ocrevus. That is a 6-hour infusion every 6 months. Tisabri is a 1 to 2 hour infusion once a month. Ocrevus is currently the only medication FDA approved for people with progressive MS. So MS is not a simple disease to say, hey, I have this symptom, go to the doctor, get it diagnosed, and get a treatment and feel better. We live a happily ever after. It is a lot of ups and downs. It takes time. It takes months to years. In my story, it took years. It took 7 years. I was formally diagnosed in March. It doesn't always mean someone will be in a wheelchair. It always depends on how progressed their disease is, but medicine has come a long way, and they prevent that from happening as much as they can. So I have a motto, and that is, people have MS, but MS does not have them.